Veterinary medicine is a messy business both physically and emotionally. Explaining is one veterinarian's attempt to explain and understand her own profession a little better. Join Dr. Lisa McFadden as she delves deep into the medical and business aspects of veterinary medicine. Welcome back to the second half of my interview with Dr. Foreman. I'm going to call this segment Tyler's Tips, because we're going to tell you all about the ins and the outs of having an excellent resume, as well as conducting a great interview, and what you should and should not think about when considering your salary or pro-sal as a veterinarian.
And I assume that this isn't just a trend where I am, but so I myself do not do surgery unless I absolutely have to.
Sure.
Just because I didn't have a lot of training, like even during my internship. I if it's a laceration repair, like if it comes broken, I'll fix it. I just try and not, make the initial incision.
Right.
But I know that surgery is usually a higher dollar procedure. So, toe to toe, I'm almost always, unless all I see all day are super sick animals, going to bring in less than, a surgeon if they worked a 10-hour shift and all they did was surgeries.
Sure.
So in veterinary medicine, I know one of the things that's hard among veterinarians is justifying, because the amount you're paid, whether it should be or not, is in part how you value your worth, right?
Sure.
So, and you shouldn't, right? Especially
Right.
if you listen to every self-help book out there.
Right.
Satisfaction should be what brings your self-worth. But, if you're somebody like me who does not do a lot of surgeries, then you're kind of reliant on either increasing your volume or increasing the amount of services you offer, correct? So that's part of why I did acupuncture, chiro, is because then I can at least bring something else to the table. So people out there, I promise there is a question. People out there like myself, and it seems like it's more of a trend that a lot of...
Sorry.
That's okay. I'm expecting a package today, so I was just waiting for my dog to freak out. So it seems like it's more of a trend that younger grads don't want to do surgery. And I mean like the last 5 years.
Yeah.
So for graduates who are not interested in doing surgery, would you recommend they start with other skills that can bring in higher amounts per? There's a question. I just don't know how to say it.
No. I think I'm with you. I know exactly where you're going, which really I think what you're asking is if you're uncomfortable with surgery, and I think that's a reasonable discomfort to have. Surgery is not for everybody. Certainly I think all of us should absolutely be comfortable spaying and neutering, right? But yeah, I mean, is everyone going to be comfortable, making a decision into the intestines and pulling something out and then closing it up and then going to sleep at night and actually being able to sleep? Not everyone can do that. And I'm certainly sympathetic to that. So the first thing I would say is if you're young and you're even not sure if surgery is for you, try. Find someone who is comfortable doing surgery, learn from them, see if you can pick up what makes them comfortable, what makes them successful. Because if you do, it will add a lot of value, monetary value, to the way you practice, and to your ability to earn income throughout the rest of your career. That goes doubly for orthopedic surgery, but that's even harder. And certainly for me, I understand, even more scary. I think the way you really add value as a veterinarian in the practice, whether you can do surgery or not, is can you provide services to your client that are otherwise not readily available? So I think you make a good point. Acupuncture and chiropractic medicine, they are definitely strong value adds, especially as we're dealing with an aging pet population, right? I mean, problems that for years and years veterinarians have had to deal with, but with really only Rimadyl and, that's it, right? I mean, just NSAIDs and kind of weight loss, which weight loss is important, don't get me wrong, but we really haven't had a wide variety of ways to treat aging ailments. So I think that's a great value add to your clientele. The other thing is, just because you don't necessarily do surgery, dentistry is a great way to add a lot of value. It's a much higher margin service than even something like, just your routine diagnostics, x-rays, things of that nature. So dentistry is great. All of our dogs and cats certainly probably need more dental work than we're able to provide. So dentistry is an often overlooked, I think, skill for veterinarians, at least from what I've seen. There's just not as much emphasis on dentistry. Certainly I've seen it when I practice, especially in the emergency setting. If the dog is sick, you aren't talking too much about their teeth, but dentistry is a great way to go. And then really, again, offering best medicine is another way for veterinarians to ensure that they're getting, that they're able to value what they're doing. So I think the big struggle we have as veterinarians is we know what we want to do, but can the client afford it? Or does the client perceive value? When we have that 2-year-old golden who's, vomiting and diarrhea, are they going to perceive value in our diagnostics? They should, right? When the way we pitch it, the way we sell it, they should perceive value in us ruling out the bad things. Is there a sock in the stomach? Or, God forbid, did the dog pick up Giardia at the dog park? But a lot of times, I think the way we approach talking to the client about that, it's just not and through anything we're actively doing, but for things we're not doing, they're not perceiving the value. So a very easy way, if you don't do surgery as a veterinarian, if you're not as comfortable with dentistry, which I definitely fall into that camp, if you are not comfortable with those two basic high margin procedures, is just ensuring that you are you have a high what we call it, ATC, average transaction per client, what a lot of companies call ACT, average client transaction, which is every client you interact with, they are spending more money because you're providing more for the client. So in that way, if you're only seeing 10 cases a day, but each one of those cases is spending $250, then you're probably producing at the same level as someone who's doing a couple surgeries and seeing a normal appointment book, if that makes sense. So there's definitely, I would say, just because you are uncomfortable with surgery and dentistry or both, absolutely. Finding other things to offer your clients, acupuncture, chiro are great options. Taking a course in diagnostic ultrasound. If your clinic is lucky enough to have endoscopy, learning how to do that procedure and that methodology, being really good at convincing your clients to perceive value in what you're offering them in basic blood work, x-rays, fecals, annual senior lab work, things of that nature. There's far more opportunity than I think we're led to believe beyond just surgery and dentistry. So I think I really think it's a great question. It's something we should be thinking more about as young veterinarians and as veterinarians as we progress.
So along those lines, I'm gonna also pump you for more information about.
Yeah.
So based on your experience, especially doing recruiting, like what are some top recommendations, or what really made a candidate, especially new graduates or even those that are still in vet school, like what made them stand out compared to ones that you weren't as excited about? And that can be on their CV or on their phone interview.
Yeah. Without question, the things that stood out to me, which are going to sound so basic, but they absolutely were first of all, the candidates that communicated on a regular basis. So if I was interested in you working for us and I either sent you an email or placed a phone call, you returned that email or phone call within 24 hours. Only about 30 to 35% of the veterinarians that I would talk with could accomplish that basic fact. So by doing just very, very basic stuff, you can set yourself apart from the vast majority of your peers. The ones in person that were by far the best are the ones that come engaged. So they spend time in the practice, they're asking questions, they're actively looking for things to do in the hospital. They're not sitting on their phone in between appointments. They're not just looking at the computer to do random things. They're actively, looking for ways to engage with the staff, engage with the veterinarians, and showing an active interest in potentially working at that hospital. And honestly, the best candidates that I can remember, we've hired a couple of them, but there's a couple we didn't hire. And I still know exactly kind of what their names are and where they went, and was really sad to see them go. But because they did all those things, even though they ultimately didn't come in and want the job, they were just so impressive because they really showed that your time was valuable. And I think that is by far the most important part. Veterinary medicine, especially vet school, prepares us to be great clinicians, and I think all the vet schools do just that. So on resume and CV, I'm not necessarily looking for things of, what you physically did in vet school. It's more I'm looking for how you're going to come across to the client in the exam room, because I come in with it thinking, at least for our veterinarians coming out of vet school, everyone's pretty much on the same playing field on day one, to me. So what are you going to do to separate yourself in the exam room? Because again, we all know, I think most of the time to run a parvo test and a 10-week-old with vomiting and diarrhea, it's okay, how can we convince the client to run that parvo test so we can show them it's parvo and tell them how we're going to treat their patient and make them better? Those are the skills that I'm looking for. And I think, honestly, most recruiters are looking for as well. I, with my business background, and I was as guilty, if not more guilty of this than anyone else, had a terrible resume before business school. So I put a lot of work into mine. Most of the resumes I see probably wouldn't pass muster in the business world, but they're fine for veterinary medicine. That being said, to anyone who's listening, if you want one hint on your resume at how to make it better, the more you can quantify your experience, the better. So again, if you think about what I just said in the sense of everyone coming out of vet school to me is on equal footing. Well, if I look at 10 resumes, but one resume says I did, 50 spays my fourth year, I was president of my class, and by being president of my class, I ran a major fundraiser and we raised X amount of dollars, or, I was at an externship and I was with a veterinarian and we saw 30 cases a day. I mean, the more you can quantify your experience, the easier it is for me to understand what you did. Versus if everyone else who says, I did a bunch of spays and neuters, I did a bunch of blood draws, I vaccinated. To me, I'm assuming you did those things because you're licensed to practice veterinary medicine. So the more you can quantify your experience on paper, the easier it is for anybody reading it to say, oh, okay, they did this many. That if you're like me and you understand what that means, it should be pretty easy. Even if you're not, if you're a recruiter who has very limited experience with veterinary medicine, it's still much easier than saying I did spays and neuters versus I did 50 spays and neuters. One stands out versus the other. Sorry, that's probably a little tangent there, but.
No, I thought it was really good. Because one thing I always wondered is I always got, like, from the recruiters, even when I had my own business as a relief veterinarian for a few years. And, even recruiters sometimes would hire for relief,
right.
which would, and I don't know if that was like an Illinois specific thing or if that's a common thing, but they would fuss at me because they would tell me my CV was too long,
right.
which I always thought was weird because in my head that quantifies what you've done. But I guess people get bored after reading like page 1 and they don't.
So I think that's the difference between CV and resume. So a CV is everything in your life from, the time you started academics until, really the time before you either retire or, God forbid, pass away of hopefully very old age. That is what a CV is. And CVs are really more for academia. And CVs will often run 30 plus pages. And that's totally.
And mine was too short.
Exactly. For a resume really should only be 1 page. 2 is fine, especially when, you get into, your experience level where you've had multiple jobs, you've had multiple different levels of experience, you've had multiple certifications, multiple degrees. But for especially our younger veterinarians, 1 page really is about all you need. And that's what is so hard, because it really comes down to not only how you format your resume, but what you choose to emphasize. And again, that's one of the reasons when I say, most resumes that I see wouldn't pass muster in the business world, because in the business world, when you're applying for a job, first of all, unlike in veterinary medicine where many people who are applying for a job are the only person who applied. Most jobs posted out in the business world are getting hundreds, if not thousands of applicants, right? So there's a big difference there on being able to, or on needing to separate yourself from your peers. Most professional recruiters, HR professionals out in the business world are spending a total of